Well, June is Men's Health Awareness Month. It's really a time to set aside time to raise awareness on healthcare issues, especially when it comes to men. Joining me today to talk about men's health is Dr. Morteza Tavakol, a cardiologist at Jupiter Medical Center. Doctor, thank you so much for being with us. Unfortunately, men on average are just not going to the doctor like they should. Why do you think that is?
Well, because we feel like we're healthy, we're active, we just don't have enough time during the day. There's so many other things to do. We often don't make time for ourselves to go to the doctor.
Okay, so let's say a lot of women watch this show. So women out there have men in their life. What can we do to help encourage?
Just push them. Hey, you got to go see the doctor. You got to get your checkup. You got to look at this. This is our family history. You have your mother or father had this happen to them. You need to go and get yourself checked out to make sure that you're okay.
Heart disease is one of the leading causes of death when it comes to men. So what can they do? We know a healthy diet, exercise, but what can they do when they go to their primary care physician to make sure that their ticker's working well?
Okay, yeah, definitely. Certainly, going to the primary care physician is the first stop, and letting them know if they have any family history or other risk factors that predispose them to having coronary artery disease or heart disease. And from there, the primary care doctor or the cardiologist, if they choose to go to first, will order the appropriate tests. Sometimes you can do a CT calcium score. We do EKGs. We can do ultrasounds, other things to look at their hearts just to make sure that they're doing okay.
And what would be a symptom or sign right now for a man out there saying, "Oh, I'm fine. I am healthy"? What would maybe be an indicator that it's time to go to the doctor?
Well, any chest discomfort, for shortness of breath, fatigue with activity, any exertional related symptoms, any passing out episodes, any just general fatigue and loss of energy could be signs that there may be some heart disease going on.
And men who carry kind of their weight in their belly and their chest area, that's always really concerning too.
That is always concerning, correct, especially if they also carry in their necks, and sleep apnea is a big risk factor. Central obesity is a big risk factor for heart disease. So those are things that need to be paid attention to and evaluated further.
So let's say men in their 40s, they're going to go to their primary care physician for an annual checkup. What should they be asking for? Like blood work? Should they be asking for PSA tests? What should they be asking for once you turn 40?
Well, with respect to heart disease, they should ask for an EKG, and then they should ask for blood samples to look at their cholesterol. And other factors. And then if they have a strong family history of heart disease, they should ask for any further testing that might shed some light if they have early risk factors or that are early plaque buildup or other things that are building up without them knowing about it.
And family history is so important when it comes to heart health. So,
very much so.
All right, good information. So if the ladies out there watching, encourage your loved ones to go to the doctor, and men, do it for your family, do it for your health, but also your family's health. Make sure that your heart is working well. Doctor, thank you so much.
Thank you.
Good information, good reminders. If you'd like more information, you can head to our website, WPBF.com. You can download our free WPBF 25 News app for all that information.